Hi, everyone. It's so good to see everyone here today. This is such a great event, and I'm so excited to help people to find awareness and get back on track with their health goals. I've been in practice for close to 25 years, and when I first started off in practice, I thought that I would be able to fix everyone through chiropractic adjustments. I'm a chiropractor by education, and over the years, I have added being a functional medicine doctor to provide the tools to my patients. Functional medicine basically means that you are looking for findings to explain the physiological dysfunction and imbalances as opposed to treating a symptom of a disease or a chronic syndrome. I use natural supplements, herbs, and homeopathics, as well as co-managing my patients with other medical providers to help heal the body in an optimal way. My first realization that we were missing a big part of the equation was dealing with people with chronic pain. Many people seek chiropractic care for acute or chronic pain. Traditional chiropractic really works for a lot of people. It's non-invasive and can provide pain relief. It helps patients with musculoskeletal pain, such as neck pain, low back pain, headaches, knee pain, get significant relief from their aches and pains. However, when people have pain for less obvious reasons, people experience temporary relief, but the pain returns. These experiences with my patients prompted me to dive deeper into patients' health history to find the root cause of why they were dealing with chronic pain. This has completely changed my role as a clinician. When I see a new patient, I listen to their health history, I look for signs and symptoms, and review their blood work and other pertinent tests. I connect the dots to try to figure out what's going on, and then focus on fixing the root cause, as compared to providing symptom relief. This approach has changed the lives of so many of my patients and makes me excited to be a clinician. During my career, I've seen a lot of patients in the office with widespread joint pain, depression, insomnia, fatigue, and a vast variety of digestive issues. Many of these patients were at the point where they really weren't functioning well anymore. Some were taking a lot of medications and even natural supplements with less optimal results. The pain and the symptoms just didn't make sense, and the dots weren't connecting. Many of these patients were coming to see me after seeing a lot of other physicians and providers. They had had many tests ordered and had spent a lot of money, yet continued to be miserable. It was at this point in my career I realized my patients needed me as I became more informed and enrolled in more functional medicine education classes and started to get the information that was needed to get them better and keep them healthy. It was clear to me that a lot of these people had been suffering by an illness brought on by a tick infection, such as Lyme disease. Lyme disease in Northeast Ohio and the north part of the US is a really big deal. It is making a lot of people sick, and unfortunately, a lot of these people are not getting the proper diagnosis and subsequent medical care. There is a general lack of education amongst healthcare providers and the population at whole. This lack of education, unfortunately, starts at the hospitals and medical clinics and works its way down to patients and families who care for these sick patients. Today, I plan to educate you on what you can do to keep you and your family safe from ticks and what to do if you find a tick or get bitten by one. I will educate you on the signs and symptoms that could result in acute and chronic Lyme. The French philosopher Francis Bacon said that knowledge is power. It isn't merely about accumulating facts. It's about acquiring understanding and the ability to apply it. So let's get started. What is Lyme? Lyme disease is caused by a bacterial infection. The bacteria is called Borrelia burgdorferi, and it is spread by an infected tick. It's typically deer that carry these ticks. And if it's untreated or not properly treated, it can result in chronic Lyme disease. Unfortunately, people are not always aware that they have had a tick bite. And this makes it difficult in terms of the diagnosis. Other things that a lot of people don't know about Lyme disease is that you can get it more than once, and that it can be transmitted to the baby during pregnancy. This doesn't mean your baby will be born with Lyme and show symptoms of Lyme, but there is a chance that during their life, whether it's a teen or an adult, that they may develop chronic Lyme syndromes. Also, it is transmitted by sexual intercourse, so your partner can become affected with Lyme over time. I have seen in my office many patients coming in with years of being sick, and now their spouse is sick as well. And oftentimes, the spouse has contracted Lyme and is starting to go down that path of chronic Lyme as well. It is very prevalent in this area. 3 summers ago, 100% of every test that I ordered on a patient for Lyme disease was positive. In 2024, in this area, they estimated that up to 50% of the ticks were carrying Lyme disease. So what do we know about ticks? So ticks are basically these blood-sucking parasites. They're pretty small, they have no wings, and they're 8-legged. And as I previously mentioned, the black-legged tick is the one that carried Lyme disease. And it's deer primarily, and mice, that carry the ticks with them. It's an interesting fact that the deer don't get Lyme themselves. They just house the ticks and carry them around with them. Ticks live in forests, grass, shrubs, and mulch. They prefer warm, moist, humid, dark places, and they're most prevalent in the months of April through September. They feed on the blood of humans and the animals, and they can also carry other infections outside of Lyme disease. These infections being anaplasmosis, ehrlichiosis, Rocky Mountain spotted fever, Bartonella, and babesiosis. Those are the conditions that we mostly see in this area. There's other conditions that they could carry. And this is what we would call Lyme co-infections. Here's a picture of ticks. The second one down on your right, that is a nymph size, and it is about the size of a poppy seed. They are pretty tiny, and they're very easy to miss. So you need to be extra careful when you're looking for ticks to make sure that there's not those tiny little ones there. Prevention is key, and this is where it needs to start with you and your family. You need to avoid ticks and being bitten by a tick. If you find a tick, it needs to be removed as soon as possible. There's less time for it to transmit the disease, the less time that it's attached. It's also very appropriate that you dress appropriately. So wearing shoes, hats, long sleeves, tucking everything in as much as possible, and wearing light-colored clothing is very helpful. The CDC recommends using chemicals such as DEET, picaridin, and IR3535. These are chemicals, but at times it's needed. If you're in a highly populated tick area, you just may want to put those chemicals on so that you're not putting yourself at risk. There are other natural options using lemon and eucalyptus oil. They are very effective, but anytime you're using something natural for a bug or tick repellent, you have to be extra careful and reapply and make sure that you're diligent with the application of it. Once you get back home, or as soon as you can, take a shower or a bath, and check family members often and make sure that there's no ticks on them. Pets are also something that you should be looking at and treating. You can buy over-the-counter a monthly pet tick and bug repellent, and I think it's a good idea to do that. So, what do you do if you see a tick? So I hear some pretty crazy stories of what people have done over the years. The best thing to do is get a good clean pair of fine-tipped tweezers, and you want to grab the tick by the head and just pull it straight out. Do not put heat or any goofy kitchen things on it. I've heard people put honey, alcohol, even butter. So if you want to kill the tick that way, once it's off the body, feel free. But the best thing to do is to flush it down the toilet, or you could soak it in alcohol. And then make sure that you recheck the body. Make sure that there was no other ticks that are there. So if you do find a tick, what should you do? First off, if you haven't properly removed it, you need to go seek medical care and make sure that it is removed. If it's not, it won't heal properly, and you can still risk getting an infection in that area. Testing is needed if the tick has been attached for more than 24 hours or if the tick is engorged with blood. Many sources say that if it's not attached for more than 36 to 48 hours, that your risk of infection is low. But I disagree with that based on what I've seen in practice. It's better to err on the side of taking an extra antibiotic than getting chronic Lyme. The way that we test for Lyme is through labs. Your local doctor can order these labs. Chiropractors can also order them. And basically what we look for with the standard lab testing through the local agencies is we're looking for antibodies. There's two different types of antibodies that we're looking for. We're looking for IgM and IgG antibodies. The IgM is for an acute infection. This is an infection that has happened within the past 6 weeks, and the IgG is a chronic infection that's been there for over 6 weeks. Something really important to note here, and this is something, and it shocks me how often it happens, but some people go to the hospital, have the tick removed, and they'll draw blood, and they'll say, oh, you don't have Lyme disease. It takes 2 weeks for the antibodies to build up in the body for the test to be valid. Local hospitals in this area who are using the CDC guidelines are fairly adequate at diagnosing acute Lyme. However, it's questionable in my experience whether it is reputable to diagnose chronic Lyme. I would not use local labs to diagnose chronic Lyme. The chance of getting a false negative test is too high, and the impact on your life is too high. There's a lab that I've used, it's called Igenix. They have a higher degree of accuracy, and there's also another lab called Armin, and Armin does similar testing as Igenix, and they also have an additional testing not offered by Igenix that I believe is superior in terms of finding out if there is some Lyme in the body. A number of years ago, the CDC changed the testing criteria. The big rumor is that they removed some of the bands, and bands are basically used as part of the test. It's called a Western blot, and we're looking for a number of bands to be present. And it is rumored that the CDC removed 2 of these bands. So by removing these bands, a lot of people are being told that they don't have Lyme disease when they do. Although these tests are more expensive, they're worth the money in getting them done. For acute Lyme, we're looking at a bullseye rash. That's what everyone thinks when they think of Lyme. But don't always rely on it, as it's not always present. If it is present, you have Lyme disease. But if it's not present, it could still be in your body. The most common symptoms for acute Lyme are fever, joint pain, stiffness, and being really, really tired. People get bad headaches, and they'll start to experience swollen lymph nodes, especially around the area where the infection occurred. People can also develop more serious issues with psychiatric illness, which is issues involving brain function, cardiovascular, which is the heart, neurologic infections, that's the nervous system, meningitis, encephalitis. So there's infections that happen within the brain. It could take 2 weeks or longer for these infections to develop. They don't always settle in right away. And the other disturbing part about Lyme disease is the symptoms can disappear over a period of time, even if you didn't treat the Lyme. And they can remanifest themselves in weeks, months, or even years later. This makes the diagnosis especially tricky. Chronic Lyme disease is called the great imitator, and it's called this because of the similarities that it shares with so many other conditions. I see a lot of people in my office who are suffering from autoimmune conditions, and a lot of these people are suffering from autoimmune issues because they have some sort of immune dysfunction, and oftentimes it is Lyme disease. So it is important, if you have been diagnosed with an autoimmune condition, that you do look for a deeper cause, the root cause of why your body has that. An autoimmune condition is basically an activation of your immune system. People carry a genetic predisposition to different types of autoimmune issues. And when your immune system is compromised, you can activate that process in your body. And the blood work, everything will correspond with an autoimmune condition. Other things that I see in my patients, and like your feet hurting is a huge one. When people are constantly complaining that their feet hurt, sometimes it's knee pain, stiffness in their hands and feet. And the other thing that starts to happen is severe joint pain. One day the elbow's excruciating, 3 days later it's the shoulder, the elbow feels great. So if you're having joint pain that's spreading from joint to joint, you need to be thinking that maybe more is going on than simply there's something with that joint from some sort of injury. The other thing that can happen in people with chronic Lyme is their mood gets disturbed. People aren't really happy anymore. They walk around with a gray cloud on their head, and they're very teary. They're also finding mixed emotions with anger, where they're not properly responding to a situation. Other patients are severely tired. They wake up in the morning tired, they function tired, and unfortunately for some of those patients, they're not even sleeping well at night, despite being exhausted all day. They go to bed and they wake up, or they simply can't sleep. Other issues that we see is depression, anxiety, panic attacks, racing heart, swollen lymph nodes, rashes, digestive issues. So I think it's important if you are experiencing some of these issues to try to figure out why you're experiencing them. If you have swollen lymph nodes, you have an infection somewhere in your body, or possibly cancer. So it's really important not to ignore those things. The other thing with some of these symptoms that people are presenting with is they could be due to some of the co-infections that people get when they have Lyme. So talking about Lyme with kids, this can be a different thing. So when I'm talking kids, I'm pretty much talking age 13, 14, and under. So kids are at greater risk for getting Lyme disease. Part of that is they roll around in the ground and mulch and all of those things. They're also less aware of their bodies and what's on their bodies. When kids get acute Lyme, they don't get exactly the same symptoms of adults. So maybe they're laying on the couch and they have a stomach ache, or they're sensitive to light. They're just not feeling good. And if there's no rash, mom and dad aren't thinking that maybe we should get their child tested for Lyme disease. So really pay attention to how your kids are feeling and make sure that it makes sense. And if it doesn't make sense, go get some blood work done 2 weeks later and just make sure there's no antibodies in your child's body. There's another complication of chronic Lyme in kids, and it's a condition called PANS. It stands for Pediatric Acute Onset Neuropsychiatric Syndrome. Basically, with this condition is you're going to see your child evolve into a monster, a very angry, teary, sensitive person that you'd never seen before. They'll start to have trouble in school, they'll have sleep disturbances, and they also start to exhibit tendencies such as excessive compulsive disorder, where they're fixated on something. Germophobia. They're so scared of all the bugs, they're constantly washing their hands. They don't want anyone to touch their stuff. Food sensitivities. They're now all of a sudden not wanting to eat foods that they were previously eating. And ticks. So a tick where maybe they're constantly rubbing their clothes, or they're rolling their eyes, or things like that. And it's a fast onset. It happens pretty quickly over time. PANS hits very close to my heart. And I'm going to try not to cry. So my son, Evan, when he was 13, he had a tick behind his ear. Had been there no more than 48 hours. And I removed the tick, and me with all of my vitamins and everything to help get him better, I gave him some supplements, and he never was sick. He seemed fine. There was no rash, there was no flu, there was 0 symptoms. 6 months later, we were on vacation, and I remember Evan's lymph nodes. in his armpits, his neck, his groin. He had massive issues. My husband and I thought, gosh, maybe our kid has cancer. We just did not understand it. When we got home to Ohio, we did blood work, and the blood work was perfect. There was absolutely nothing showing up with Evan. 6 months later, we did more blood work on him. At this point here, he was tired, very tired, and this is when he was starting to get angry. But now he's 14, and you think 14-year-old boys maybe are just angry. He was running, cross-country running at this time, and he kept on getting injured. He had lots of pains in different parts of his body. He got exercise-induced asthma, had trouble focusing school. We never connected the dots at that point. It wasn't until another year had passed, and I remember this day. I had been at my office, and my last patient, I had done a follow-up with this 16-year-old boy that had come to see me a year earlier and was diagnosed with chronic Lyme. And he had this PANS syndrome. And he was telling me that day and thanking me that he could sleep, he was happy, and he no longer had the number 2 or maybe zigzag. He no longer had that in his head, and he could go to sleep at nighttime. That night, my husband was at tennis, and Evan came down, and he put his head on my lap and said, "Mom, rub my head. I haven't slept in 3 days." We had no clue. He had stopped complaining to us because we weren't really listening to him. And he told me that he was seeing the same thing. It was the 2 or the zigzag. And I knew right then that my son had chronic Lyme. Okay, so happy to say we were able to diagnose him. Didn't take him to school the next day, went to my office, did all of my testing, did the labs through IGeneX, and 3 weeks later, we had the confirmation that we needed, and we started treatment. And 3 months later, my son was back. So, a lot of mom guilt over that one. Very hard to see when I have patients coming into my office and their children, their families have been suffering from this. If you know kids that have had a quick change in their behavior and they're having those symptoms, it needs to be evaluated. Psychiatrists, psychologists in this area, shockingly, don't address PANS or PANDAS. PANDAS is a similar situation that can happen to kids from a strep infection, and it basically results in the same issue. So one thing to note when kids have this PANS syndrome, it's not Lyme disease in the brain. It is a reaction of inflammation that the brain has, specifically the basal ganglia, and that is in response to the spirochetes, which is the Lyme bacteria, being in people's bodies. So what do we do if you have chronic Lyme? So one of the things that I recommend is keeping track of the symptoms. Sometimes you get to the doctor's office and you're so overwhelmed with everything that's been going on that you don't even know where to start. So make sure that you're journaling your symptoms. And if you have been to a ton of other doctors and you have a lot of blood work, go through the blood work ahead of time and flag the tests and highlight them that shows an abnormal test. Because sometimes giving a doctor a stack of lab work like this is a little bit daunting. And if you can flag it and know where to start looking, that's a great place to start. Knowing more information helps practitioners such as myself decide what tests to run, and it can also save money to the patient by not repeating tests that have been done. The treatment will depend on the symptoms, and one of the biggest things, if you are experiencing chronic Lyme, is you have to work on getting your immune system in check. Lyme disease can hide in your body. A lot of time when people have chronic Lyme, they'll tell me that they're never sick, that they haven't been sick in a few years, and that's not uncommon. One of the things that we need to do is activate the immune system, and I'll go into that shortly. Dr. Dowles, who is here today, he has developed a superior treatment for treating chronic Lyme, and it does cure Lyme disease. Using other holistic approaches basically puts the Lyme into remission. And that does work for a lot of people. but unfortunately, it doesn't work for everybody. So, improving your immune system. So what are some easy things that you can do? So have a good night's sleep. Get to bed on time every night. If you are waking up at 7 a.m., you need to be in bed by 10 p.m. If you're up at 6, you need to be in bed by 9. If you stay up later than those time frames, you're going to wake up or you're not going to fall asleep and stay asleep. So it's really important that you watch that. And kids also need a lot of sleep. Depending on the kids' ages, they can need 11 to 12 hours of sleep. So make sure the kids are getting the sleep that they need as well. Exercise daily. This is a hard thing to get people to do. They say walking 150 plus minutes a week is ideal. The more, the better. Weightlifting is super important, keeping your muscle strong. As people age, their muscle tone goes down. And if you don't have good muscle tone, especially in your legs as you get older, you're going to have a lot of problems walking around. And also with exercise, try to walk around in bare feet and do some grounding. Grounding helps you to reconnect with the earth, and it's very balancing to your system. Support lymphatic function. This is huge. A lot of people don't even understand what the lymphatic system is or the importance of supporting your lymphatic system. Your lymphatic system basically takes away the leftovers of the infection. It's how your body flushes out the trash that the immune system collected. In terms of lymphatic function, there's an exercise that you can do. If you want to look it up on YouTube, it's called the Big Six. So basically what this exercise is you're going to do for 10 repetitions, you're going to pull for 10 and tap for 10, and you're starting on this left side here. This is a key part of the lymphatic system called the thoracic duct. And then you're going to do the same thing on the other side of your chest. You're going to go up behind the ears and pull down on the neck, and then you're going to go underneath the armpits and pull down. Same thing, the tapping and the rubbing on both sides. You'll do your stomach, you'll do the groin, and then you'll do behind the knees. After you do those, it's important that you jump up and down a little bit just to complete that whole process. Other things that you can do at home is dry brushing. You can buy a dry brush on Amazon and just start scrubbing your skin. That helps to get a lot of the toxins out. A vibration plate, those aren't super expensive either. They're about $200. A vibration plate is a round oval type machine, and you stand on it, and it basically shakes your body, and it helps to pump the lymph through the body. People use infrared saunas, people do cold plunges, those are all effective. At our office, we have a lymphatic enhancement machine, and I absolutely love this thing. I didn't even know before a year and a half ago that these existed. It is a machine, and it has these wands, and it also uses some light therapy, and it basically pumps the lymph through your body. And if your lymph is stuck, the wand sticks to your skin. So they go through a whole channel, there's all these different things that they do, and they get your lymph moving. It is pretty cool. All right, get plenty of sunshine. The sun is so healthy for us. It's a great natural source of vitamin D. Also helps with sun stimulation to our brain, our pineal glands. That's essential for keeping us happy. So don't get burnt, but make sure you're getting a lot of sun. And the whole thing with sunglasses, try to get some sunshine without always having sunglasses on, because they're going to block your body's ability to absorb the sun. Drink enough water. This is something that most people completely fail to do. I think it's a good rule, drinking half of your body weight in ounces is good. Men, you could do a little bit more. Women, a little bit less. All right, bowel movements. I think people think it's normal to be constipated. It is not normal. So 2 to 3, they say, is what you should be doing. I'd be happy with 1 for a lot of people. There's a lot of reasons if you're constipated. Maybe you're not drinking enough water. Maybe you're not eating enough fiber. You eating the fruits and vegetables you should be eating. There's also issues, and I see this a lot in women, especially if they're hormonal, where their bile is too thick. High levels of estrogen make your bile very sticky, and then that will contribute to you not being able to properly emulsify your fats, and then your stool is sticky. So if you're one of those people and you're constantly wiping and it's hard to get a clean wipe, then maybe you should take a look at your gallbladder. I recommend people use magnesium. It's just a great relaxing thing for the body and for the bowels. If you take 300 to 400 milligrams before you go to bed at night, that should help the issue. And if that's not helping the issue, despite more water and more fiber through fruits and vegetables, maybe look at getting your gallbladder checked. One of the best things, by the way, for gallbladder health is beets. So throw beets more into your diet. They're very helpful. Oral hygiene. This is one that always surprises me. You have to clean your teeth, and you should go get them cleaned at least twice a year. If you do not do those things, your mouth will have bacteria, and that bacteria will travel into your body. So make sure that you're taking care of that, because that's another thing to weaken your immune system. Bacteria from your mouth can go to your heart, it can go to your joints, and cause lots of chronic joint pain and issues. In terms of diet, inflammatory foods, we all know shouldn't eat sugar, but we still do. Dyes, people are now trying to avoid those in processed foods. Seed oil is the new big one. I don't think people realize that seed oil is probably in most of the foods that you're eating, unless you're making a concerted effort to buy foods that are cooked with olive oil or avocado oil. Those oils damage our cell structure. They damage our cell mitochondria, and that's what gives our cells energy. So you've got to look at what you're putting in your body, because it's going to further contribute to a lot of chronic illness. Eat organic foods. They all kind of look the same sitting on the grocery shelf, but the pesticides and non-organic produce is terrible. And the accumulation of these pesticides is becoming a really big deal. Get your meat organic so that there's not hormones in there. That is also really important. Don't store your food in plastic, and now they're saying don't even cook your food in aluminum foil. We get a cow every year, and what do we do with the cow? We have it broken up and vacuum sealed, and we put it in our freezer. I try to buy everything organic for my family, but the lettuce is wrapped in plastic. Everything's wrapped in plastic. So at home, if you're storing things, store them in glass containers. And there are things that you can do through binders that help your body to bind stuff that's sitting in your system that shouldn't be there. And a lot of these binders aren't specific for just plastics, but they can do heavy metal binding, mold binding. You should make it a regular part to take binders and get those toxins out of your system. Just another kind of touching the whole thing with sugar, and that there are other sources of sugar that people can do through monk fruit or stevia, which are herb-based. But a lot of people think if they eat cane sugar as opposed to high fructose corn syrup, that it's better. Sugar is still sugar, and it's still highly inflammatory. High fructose corn syrup is one of the worst things that we can put into our body. It's linked with causing non-alcoholic fatty liver disease, and that is another thing like seed oils. If you are not paying attention to what you are buying, high fructose corn syrup is in a lot of things. Condiments are one that you have to really, really watch for. The condiments that we use in our house are from Primal Kitchen. They're a little bit more expensive, but you're getting good quality ingredients in those. So limiting your toxins to what you're cleaning your body with, what you're washing your dishes with, your clothes with. So many women spend all of this money on all these expensive creams and cleansers and so forth. And I don't believe that you need to do those things. I use turmeric soap on my face, and I use Vaseline as my moisturizer. I don't put anything else on there. And I don't think it's made a huge difference comparing if I do try to do something on the other side or not. Gut health is another important one. Make sure that you're having good digestion. If you're not having good digestion, figure out why. There's a reason behind that. If you are chronically bloated, if you're having diarrhea, there is a problem, and it's important that you go and figure out what that is. When warranted, take less medication. In 2024, the global prescription revenues were $1.2 trillion. Our country, the US, used $500 billion of that, and we are consistently the most unhealthy country. So if you're having issues, make sure that you try to identify the cause of those issues. I look at people with statin drugs. Statin drugs are terrible. They cause a lot of issues, and people continue to take them because they're scared about having a heart attack or a stroke. Statin drugs have been around for a long time, and if you look at what the pharmaceutical companies are saying, it makes it very convincing. But if you look at the mortality, who's alive and who's dead 5 years, 10 years later after people taking statin drugs, you will see that the people who took statin drugs have a higher incidence of mortality. Our local labs here test for your ALDLs, your HDLs, and they all throw them into one category. Well, that's not how they are in our body. There's different sizes, and the sizes really do matter in terms of what those particles are doing in your body. I have a testing company that I use often, and it allows me to look and analyze at whether that cholesterol, LDL, is bad or whether the HDL is good. Use good quality supplements. Supplements are not all created equal. A few years ago, I had these two bodybuilders that opened up a lab in their basement. They were making their own supplements. How scary is that? The packaging looked fantastic. So you've got to watch that. It's good the government isn't regulating it, but you need to be very well aware and buy good quality supplements. The supplements that we sell at our office are all lab standardized and tested, and they are, if it says it has 100 milligrams of something, it does. I just jotted down a few things here that I think are really important for your immune system health. Vitamin D3 with K2 being at the top of the list. And I also put down MitoCore instead of listing all of the different things in MitoCore. So MitoCore is a supplement. It's from a company called Orthomolecular, and they're a great company. It has all of the multiple vitamin things, and it also has all the things that you need to stop free radical damage. And it's great mitochondrial support. The other thing is Orthoimmune. It's from the same company. It's just a good general immune system support. When COVID came out, people were rushing to take zinc and quercetin and NAC, vitamin C and D. Well, Orthomolecular put it all together, so that's what that is. I also put here other stimulating herbs that you can use for your immune system, the artemisinin, cat's claw, Japanese knotweed, echinacea, and myrrh. And then get a good quality probiotic for your gut. I don't think people should rely on taking those every day. If you fix whatever dysfunction is there and you occasionally give your body some probiotic, your healthy diet should be able to keep that going. I also wanted to touch a little bit on mold. People don't often realize the dangers of mold. If there is mold in your house, your kid's school, your workplace, this at some point is probably going to pose a threat to your body. People with healthy immune systems will beat it off for a period of time, but it eventually rears its ugly head. And it just becomes one more issue to bring down your immune system. And the other thing is, if you do have mold, you need to remediate the mold properly. A lot of the companies that do mold remediation, they're really expensive. So people think they're going to go into their garage or their bathroom and take care of it on their own. And that's just simply really dangerous. If that's the option you're going to do a lot of reading on it, get a good mask, and good luck. So, just a few other treatment thoughts. I kind of touched on this about getting good blood work done. There's a lot of other companies outside of the hospitals around here that are doing good blood work, and it is super important to look at those. The company that we utilize to look deeper in cholesterol, they do a whole body looking at all the vitamins and minerals. They're not looking at serum levels. They're looking at a part of your immune system called a lymphocyte. So you're getting a broader spectrum of 3 months in terms of what's been happening with the body. And then urine testing. So if I'm going to test someone for mold, urine is going to be my preferred treatment. And then hair and saliva. I've discovered this company that does hair and saliva testing. And they're not a lab, they're just a testing facility. But this test really helps me to figure out who are the players on this team, what am I dealing with, and what do we need to do to get this person better. The test will look at allergies to your environment, to food. It looks at vitamins, mineral, digestive enzymes, amino acid, fatty acid deficiencies. It does look at some hormone issues. But the part that I love about this is it tells me what are the toxins in this person's body. Is it a chemical? Is it a mold? Is it a bacteria? And oftentimes it will give me the direction on where I need to go to get that person better. So, just in conclusion, I know that this sounds like a lot and it sounds complicated, and I'm sure if you're here today, it's because you think that you may have chronic Lyme or someone that you love does have chronic Lyme. It takes a lot of time, it takes a lot of research, effort, and money, but most people, if they spend the time, it is worth the while to do it. Focus on eating real food, good quality supplements. Get your food from local farmers and vendors. You are blessed in this area with so many great resources. Spend your money on being healthy and not treating disease. My office, Emly Chiropractic, we have a booth over here in, I think, the middle tent over there, and my associate, Dr. Jaden Steele, is here, and we'll be here the next 2 days to answer any of your questions that you may have. Thank you for coming here and hearing me speak. I look forward to helping you get back on a path to your health. I love this quote by a Roman poet, Virgil. He said, "The greatest wealth is your health," and it's so true. Thomas Edison, he's the one who invented the light bulb. In 1903, he said that the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and the cause and prevention of disease. So wise. Have a great day, and thanks for coming to hear me speak.